Hi, I'm Dr. Jay Caylor with Pain Specialists of America. Today we're going to be talking about lumbar spinal stenosis and some treatment options for it. Now, as you remember from one of our previous talks, this is the lumbar spine, this is the front, and this is the back. In between, we have the spinal canal, in which exists the spinal cord. When the spinal cord is pinched, it can cause symptoms that are in both sides of the lower extremities. Now, some patients may have one side that's worse than the other, but typical things we look for are what's called neurogenic claudication. And that means that you have numbness, tingling in the legs, you have cramping in the legs, your legs feel weak, tired, heavy, and in general, you're not able to do the things that you want to do. The interesting thing is the hallmark sign for lumbar spinal stenosis is it improves when you lean forward. And why that happens is because of the dynamics of the lumbar spine. The spinal canal, when you stand up, actually leans back. And when this happens, it actually pinches the spinal cord more. And that's why patients can stand for less and less time as they're standing up straight. Now, classically, we have a sign called the shopping cart sign, where patients, when they go to the store, will lean forward. And that allows them to go around the store longer and be able to do more exercise or exertion. Why does that happen? Well, when you lean forward, you actually open up the spinal canal space, and that allows the nerves to continue sending signals to the lower extremities. Some options that we have for lumbar spinal stenosis, in addition to things like epidurals and other targeted injections in the back, is to either place a minimally invasive spacer or put a more permanent device that actually holds this space open. What this does is it makes the spine think that you're leaning over all the time, or think that you're sitting down, which relieves your symptoms, even when you're standing up and walking around. It's a small change, but really what it's trying to do is prevent you from leaning back and crushing that spinal cord more. So we can place a small device that keeps this open. As part of this, we always want to work really closely with our surgeons to make sure that they agree with this process. And so that's one of the great things about how we work with our partners in the community to make sure that we're offering the right therapy for you. But this is one example of a treatment option that we'll tailor to each and every one of you.